To proceed with the examination of the limbs, we now move on to examination of the lower limbs. The order of examination is identical to that in the upper limbs. It involves inspection, tone, power, coordination, reflexes, and sensation in that order. We begin with inspection. In this case, we have to make sure that the thighs and the legs and feet are fully exposed. Except the difference is the patient is now in the lying position. In a similar manner to the upper limbs, we look for any obvious wasting or fasciculations or deformities or any other abnormalities of posture or skin that strikes the examiner. So the next part of the examination of the lower limbs involves tone. It's very important that the patient be relaxed, and tone is tested mainly at the knee and the ankle, also sometimes at the hips. The way we test tone is we move the joints passively through their full range of movement in the following manner. Testing tone at the knee, we move the leg passively in full flexion and full extension, feeling for the degree of resistance and at the same time looking at the patient's face to make sure we're not causing them any pain. The maneuver is repeated on the other side to compare and contrast. In a similar manner, I test tone at the ankle. We flex the knee to 90 degrees, we flex the ankle very slightly, and then flex and extend. All the time feeling for a degree of resistance and inspecting the patient's face. And please remember to compare and contrast to the other side. At the ankle, we sometimes check for clonus, especially if the tone is increased. Clonus is checked for in the following manner. Flex the knee to 90 degrees, put gentle pressure on the ankle, and then a quick movement, and feeling for the presence of repeated clonic action. Finally, we can test for tone around the hip joint by rolling the knee in the following manner. Feeling for resistance, the next part of the examination of the lower limbs involves testing for power. Similar to the upper limbs, it's very important to ask the patient to actively do as much as they can before you examine power passively. Then, I'd like you to lift your leg off the bed. Your right leg first, very good, up as far as we go, and left leg, very good. Now we can start examining for power. It's very important to remember that power is tested in a proximal to distal direction. This is in contrast to sensation, which is always tested in a distal to proximal direction. Then I'd like you to lift your right leg up off the bed. So testing for flexion of the right hip joint, in this case, power is normal. Flexion at the hip joint involves contraction of the iliacus and psoas muscle and nerve roots L1 and L2. Then I'd like you to push down into the bed against me. Push down, please. And here he's able to resist my movement. That means it's normal. Another way I can demonstrate it is ask him to push his heel down into the bed. Push your heel down into the bed. I'm now testing for hip extension. Hip extension is innervated by the sciatic nerve and nerve roots L5 and S1. Moving down to the knee joint, and bend your knee. Now I'd like you to straighten your knee, straighten your right leg. Ben is fully able to straighten his right leg against me. This involves testing the quadriceps. The quadriceps is supplied by the femoral nerve and involves nerve roots lumbar 3 and 4. Proceeding with the examination of power in the lower limbs, we're now going to check for knee flexion. Ben, I'd like you to bend your knee to 90 degrees. In that position, I'd like you to pull your heel in towards your bottom. And Ben is able to pull his knee and overcome any resistance from me. This involves the sciatic nerve and nerve roots L5 and S1. Straighten your leg. Moving on to the ankle, we check for dorsiflexion and plantar flexion at the ankle joint. To begin with dorsiflexion, then I'd like you to bring your toes up towards your face and hold them there. Don't let me pull them down. This involves the common perineal nerve and nerve roots L4 and 5, and in this case it's normal. Then I'd like you to push down against me as hard as you can. As hard as you can. This involves the sciatic nerve and nerve roots S1 and S2. In this case, Ben is able to push me away. That means his plantar flexion is normal. So in addition to plantar and dorsiflexion of the foot, we can sometimes test for dorsiflexion of the big toe, which is specifically innervated by L5 nerve root. Ben, I'd like you to bring both big toes up towards your face and hold them there. Right up, please. Keep them up. Don't let me pull down. And again, Ben is able to resist me pulling the big toes down. In this case, power is normal. To continue with the examination of the lower limbs, we test for coordination. Again, the patient is in the lying position, and we ensure that the patient is relaxed. Ben, I'm going to test for coordination in your legs. I'd like you to do the following maneuver. Can you hold your right leg up in the air? Place your right heel on your left kneecap. Run it straight down your shin. Now, I'd like you to repeat the maneuver on the left-hand side. Do exactly the same. Hold the left leg up in the air, place your left heel on your right kneecap, and run it down your shin. We look for any evidence of incoordination or unsteadiness. So the next part of the examination involves checking for reflexes. The patient is still in the lying position, and we have to ensure the patient is relaxed. In order to elicit the reflexes in the lower limbs, we tap the quadriceps and the Achilles tendon, and then we check for what's called the plantar reflex. Before we elicit the knee reflex, we should palpate the quadriceps tendon. The quadriceps tendon is situated between the patella and the tibial tuberosity. Ben, I'd like you to bend your knee to 90 degrees. And then you feel for the quadriceps tendon there and you tap it. I find it easier to elicit the knee reflex while supporting the thigh in the following manner. And I tap the tendon like this, and here you see a brisk knee reflex. Usually it is not necessary to tap a reflex more than twice. So in order to demonstrate the ankle reflex, it's very important to get the patient in the proper position. The proper position is as follows. Ben, please bend your knee, and I'm going to bring his ankle and place it across his right leg in the following manner. Please note that his knee is flexed to 90 degrees and his ankle is flexed to 90 degrees. Now, with very gentle pressure on the foot, you tap the Achilles tendon in the following manner. And here you see a brisk reflex. I'll repeat the reflex for you. And here you see a brisk contraction of the foot, and that means his ankle jerk is intact. The ankle reflex can be demonstrated in two alternative positions. Sometimes that's necessary, perhaps when they're absent, or the patient is unable to move for whatever reason. The two other positions are kneeling, with the feet extended over the edge of the couch, or lying flat with the legs fully extended. I'll demonstrate the ankle reflex in the extended position. Just placing your hand firmly on the sole of the foot, slightly flexing the ankle to 90 degrees, just tap briefly on your fingers, and here you see a very mild contraction or an intact reflex. The other side, in a similar manner, it's demonstrated. Just as in the upper limbs, if the reflexes in the lower limbs are absent or reduced, or you're in doubt about them, it is important to ask the patient to reinforce. The way we reinforce in the lower limbs is not the same as the upper limbs. Ben, I'd like you to put your two hands together and pull them apart in the following manner. But don't do it until I tell you. Now, Ben, pull. Now I will check the ankle reflex in this position and watch. And here you see the ankle reflex is more clearly visible. It's important to check for reinforcement before you say reflexes are absent. The last reflex in the lower limbs is the plantar response. This is probably the most important reflex in the body, and sometimes the most difficult for medical students. I'd now like to demonstrate the plantar response. The normal plantar response is downgoing. By that I mean the first movement at the metatarsophalangeal joint is flexion. In order to elicit the plantar response, you take a blunt instrument, usually a key, and you stroke the outside of the foot very firmly, coming across the metatarsal heads and finishing between the first and second toe in the following manner. The reflex you're looking for is the first movement of the big toe at the metatarsal phalangeal joint. If that movement is downgoing or flexor, it is normal. If it is upgoing or extensor, it is abnormal. The final part of the examination of the lower limbs involves testing for sensation. Sensation is divided up again, as in the upper limbs, into two main groups, superficial and deep. An example of superficial sensation is light touch. We'll test for light touch in a manner identical to the upper limbs. So my patient is already trained. And Ben, I'm going to touch you in the lower limbs, beginning in your feet, and I'd like you to say yes when you feel me touching you. But you must do it with your eyes closed. Please close your eyes and say yes if you feel me touching you.
Yes. 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 Yes.
Ben, was there any difference between the right and the left side?
No.
Was there any difference between your feet and your thighs?
No.
No. The next modality of sensation we test for is deep sensation. The two tests we use for deep sensation in the lower limbs or legs is identical to that in the upper limbs. It involves joint position sense and vibration sense. I will start with joint position sense. In order to demonstrate joint position sense in the lower limbs, you grip the big toe just proximal to the interphalangeal joint in the following manner. You grab the toe with the thumb and index finger of the left hand, just proximal to the interphalangeal joint, and we fix it. Then we move the toe up and down and ask the patient to indicate the direction of movement. Ben, I'd like you to indicate which way I'm moving your big toe. This is up and this is down. Now close your eyes. Which way is that?
Up.
Which way is that?
Down.
Which way is that?
Up.
And on the left big toe, which way is that?
Down.
Which way is that?
Up.
Ben's joint position sense is normal. So the last modality sensation in the lower limbs is vibration sense, and this also requires the cooperation of the patient. Now my patient knows what to expect because I've tested in the upper limbs, and it's not necessary to test it on his clavicle. Ben, I'm going to place a beating tuning fork on your big toe, and I would like you to tell me when it starts and when it stops. Okay?
Okay. I feel it.
Tell me when it stops.
Stopped.
Very good.
I feel it.
Tell me when it stops.
Stop.
Ben's vibration sense is intact or normal.